What is your complication rate? I always encourage patients to ask this question of their surgeons, and but you want, are people going to be honest with you? And certainly, if your complication rates are really, really low, like mine, you're going to brag about it and shout about it to people. But if your complication rates are higher, then are you really going to tell people about it, or are you going to be a little bit more shy about telling people your true complication rates? When people ask me, I tell them the truth, and my complication rates are far, far below the national average. So, for example, when you talk about one of the most common complications of cataract surgery is vitreous loss, where the clear bag that holds lens in place ruptures, and if you look at the figures, the national figures from something called the National Ophthalmology Database, it can be anything sort of between 0.8 to sort of 1.4%. So 1 out of every 100 cases it can happen to. My rate is probably about 1 in every 1,000 cases, so significantly less than that. But it can still happen. You can't brag about things because, unfortunately, to the individual patient who has the complication, it doesn't matter whether your surgeon has a complication rate of 1 in a million. If you're that 1 in a million, then it's still catastrophic and devastating. So, and how do I work out my complication rate? Regular audit. Every single complication is audited, and then we get data from our hospitals as well that tell us you've had this rate of complication. So surgical complications, I'm not really worried about. Post-operative complications, things can happen. Your cornea can swell. I've had a couple of those. Most of the time it clears, but it doesn't always clear. But you do everything you can to minimise the risk of that. Infection, only ever had 1 in my entire career, catastrophic. And so that can still happen to people, and before that 1, I used to say to people, I've never had 1 in my entire career, but it can still happen. Now sadly I've got to tell them I've had 1 who was a person who had bowel disease, and bugs went through the bloodstream and into the eye, and a catastrophic. I can't obviously tell you any more than that because of confidentiality, but now unfortunately I have to tell people, please don't be my second, because that would be gutting. So, my complication rate is exceedingly low, and that is why I pride myself on what I do, and hopefully give the best to the patient. I do a lot of medical legal teaching, and I ask the question of consent, because consent's a really important thing. If you've got a very low complication rate, should you tell patients that complication rate? Because then they'll know exactly what they're letting themselves in for. Or should you go for the national complication rate, which means that you under promise and over deliver? And the response from all of the lawyers that I spoke to and things was a bit sort of 50-50 whether you should use the national rates or your own rates. So I actually use both. So I tell people the national rates and then my own rates. But you've got to be careful with your own rates, because I can say that 1 in 26,000 risk of infection because that's the only one that I've had. But then if you do get an infection and the national rate is 1 in 1,000, then have you kind of misled the patient? I don't know the answer, but you're not misleading them because it's true fact. And first and foremost, it's a very, very safe thing to have done anyway, and there are fantastic surgeons out there, but in my hands it's even safer. So my complication rate is exceedingly low, and you can look at figures and things like that, but sadly you've got to realise that complications can occur, and frustratingly it could be that very patient. It could be you, it could be your mum, it could be your husband or your wife, and they could get that. So you've got to go into these things with open eyes.